Let's do another test question, but this one will be harder, so make sure you tell me your answer guesses in the comments. So here we go. A patient with heart failure and chronic kidney disease is taking lisinopril and spironolactone. Their morning labs show a potassium of 5.8, a BUN of 34, a creatinine level of 2.1, and their blood pressure is 96/58. What do you do first? Your answer choices are A, hold the meds and call the provider, B, encourage fluids, C, recheck their potassium level in 4 hours, or D, document and continue to monitor. Okay, so this one requires you to know a little bit about pharmacology and a couple medications and also how to interpret some labs. So the stem of this question already tells us that this patient has chronic kidney disease. So you should kind of expect to see some elevation in the BUN and creatinine levels. So those numbers are a little bit elevated, but you're not to a panic level for those. So we're going to set that aside for just a second. Now let's look at the meds. Lisinopril is an ACE inhibitor. So what does that do? It's going to lower the blood pressure by blocking the RAS system, which we've already talked about. And this particular patient's blood pressure is already 96/58. So that's pretty low. We don't want to drop it any further. Spironolactone is a diuretic, so that is also going to lower your blood pressure. And this medication in particular is a potassium-sparing diuretic, meaning it will help you hang on to potassium instead of peeing it off. So now at this point, we know that we've got two medications that are going to lower blood pressure, one that is going to raise potassium, all in a patient whose kidneys are already struggling. That's the perfect setup for hyperkalemia, which is also known as elevated potassium, and that is the lab that we need to be worried about. When potassium levels get too high, it can get really dangerous really quickly. It messes with your heart's electrical system and your muscle function. You might see bradycardia, maybe even peaked T waves, or ventricular fibrillation, or VFib, which is very bad. When potassium gets too high, it can even stop the heart. So we need to make sure that we're keeping potassium down to that normal range of 3.5 to 5. So the best thing to do here is to hold both of these meds and call the provider. That way you're preventing potassium from getting any higher and also preventing any blood pressure crashes. Encouraging fluids, you would not do that in your heart failure patient. You're gonna overload them. The option to recheck labs and document is way too passive. With this elevated potassium level, you need to act on that now.